It's April 2nd. This is your update on COVID-19. We have Minister Hajdu giving us the update on NetNewsLedger. Now remember, hit that share button, hit that subscribe button on YouTube to stay up to date. It's James with NetNewsLedger. Joining us by phone is Minister of Health from Thunder Bay Superior North MP Patty Hajdu. Welcome and good morning.
Hi, James.
It has been another week of absolute craziness to a degree, but everybody seems to be slowly settling into a routine. What do our readers and viewers need to know?
Well, our viewers need to know that we have to keep it up. I think that's the challenging piece for everyone, is especially as it gets warmer outside and people want to go back to their daily lives and everybody's desperate for some, routine in their lives and some normalcy. I think that the challenging message that I have for Canadians and for people in our riding is we have to keep up the social and physical distancing, because the virus is not done in Canada, and until we actually get through this, we are going to have to continue these measures.
The message coming out of Toronto yesterday is this could be for a lot longer than we think.
Well, for sure. I mean, I know that different provinces are in different places with their curve, and actually Ontario's on the way up. And so I know the Premier is very alarmed, and I heard his message as well. And certain parts of the province are continuing to see surges, right? So, yeah, I mean, this is the challenge. The challenge is that these practices of ours are very hard to stop on a dime, and we also need essential workers for a whole bunch of other things. So we've still got real challenges in terms of stopping the virus in its tracks. And obviously, as the province prepares for surge activity at hospitals, it's very alarmed in terms of the numbers it's seeing. And as we see sort of increased testing, we're also seeing just the sort of just the prevalence in communities, and that's scary too. So I understand the dire messaging coming from the Premier, and I have spoken obviously with Minister Elliott a lot, and she is equally concerned. So we're working really hard with all of the provinces, but in particular Ontario and Quebec right now, as we see sort of surge activity in those two.
The National Post yesterday had an article talking about some of the shortages of critical medical supplies. What is happening?
So, first of all, we have an incredible team of people from a number of departments all across the government trying to procure things, trying to buy things that we need in the country. I mean, the shortage really started, if you think about it, where the outbreak started. And in China, they were in an outbreak surge situation from late December all the way to, mid-March, and even now they're still challenged in certain capacities in terms of their ability to get their economy up and running. So that coincides with the fact that so much of this equipment is actually produced in China. And so as you can see, them using a product that's made in China and then having a challenge to bring up their production levels, and then on top of it, having the world go into essentially a pandemic mode, it's made buying things very, very difficult. So we continue to work on that. There are some positive progress, and certainly we're starting to see larger donations as well from partners across the country, and we're starting to see businesses be able to really ramp up their domestic production of certain supplies. But it is a very challenging space, and I know that hospitals are working flat out trying to make sure they have a system that will help them get through with the personal protective equipment. But this is a crisis, no doubt about it, across the world, and Canada is strongly working on this issue to try and get more protective equipment for people all across the country.
I was talking to Minister Greg Rickford from Kenora earlier in the week, and he was saying that what Ontario is feeling right now is this is going to slowly slow down into the summer, but there's a threat that it could be back by the fall. What are you doing in the Department of Health right now to plan for any future pandemic or things as that, or are we just on the crisis mode right now?
It's two things at once. I mean, obviously he is right, first of all, that because there is no cure and because there is no vaccine, we will see continual waves of this. But what we don't know necessarily is the severity of the illness, whether the virus will mutate and what kinds of mutations will happen. Sometimes viruses mutate to become less deadly. Sometimes they mutate to become more deadly. So yes, I have a whole crew at Health Canada studying not only the biology of the virus, but also what we can anticipate in terms of our own projections. We have what's called modelers that are looking at all of the provinces and territories and the measures that have been taken, the disease attack rate, and what we can anticipate in terms of any potential immunity. And we have our entire Canadian research community also on this problem, because if we can determine immunity, that may also help us with future waves. All that to say, all of that is happening all at once. And so we've got people working on the emergency sort of surge that we're seeing now, and also the longer term question of how do we get out of this and what do we do to protect Canadians as we see future waves of COVID.
There's programs coming from the federal government to assist families. Unifor is out today saying that we need to move faster on getting that information and the availability to apply out to Canadians. What would you respond?
People can apply as of today for COVID-19, the COVID emergency benefit. This is the benefit that's essentially replacing EI. It's $2,000 a month for anybody who's lost their work due to COVID, who has $5,000 worth of earnings in the previous year. And so if you download the Canada COVID-19 app, on that app, it will link you to the information you need to follow to apply for those benefits. We're doing a staggered intake right now just because of the volume of people that are going to be applying for this. And so there's instructions on that app and on our website. Also, residents of Thunder Bay Superior North can call my office, and I still have my staff working from home, ready to assist people who may not be able to access the information digitally, or who are having trouble applying.
What number should they call?
Call the Constitute office. There's a 1-888 number, and I'll give that to you. 1-888-266-8004.
Is there anything else that our readers and viewers need to know?
Well, I think the thing that people need to know is that the only way that this virus can live is if we keep spreading it between each other. And so as much as governments are doing to try and understand this from a scientific perspective, to come up with better therapeutics and vaccines, to take measures to limit people's activity, ultimately, at the end of the day, it will be up to all of us to stop moving about and stop giving this virus an opportunity to spread. Some of us can't because we're essential workers, and so it's really important that we protect the health of those essential workers. If you're out in the grocery store, stay 6 feet away from other people. Respect the fact that that person at the cashier has to do their job so that you can get their food. So make sure that you're washing your hands, that you're covering your cough with your arm or with a tissue, making sure that you're taking appropriate action in and out of the home, and really limiting your non-essential travel. People should be staying at home. People should be going for walks outside, staying 6 feet away from people, really making sure that we clamp down on socialization. Right now is a very difficult time, and the need is more profound than ever for us to stay connected to our loved ones, which makes it really, really hard. But, think of digital ways to do that. Make sure that we are reaching out to people by phone, by email, by Skype, all the different tools that we might have. But know that if we don't do this, then we'll see cases rise.
One last question, Minister. Kashechewan up in northern Ontario is experiencing its annual flood. The City of Thunder Bay has said they cannot accept any evacuees. Are there moves happening to start dealing with these kind of situations?
There sure are, and I spoke to Mark Miller, the Minister of Indigenous Services, yesterday about Kashechewan and also other communities that experience evacuations every year. They're working right now with the First Nations on solutions that the First Nations would find appropriate. As well, there are evacuation plans for sick people underway, and so that work is continuing. I think this is an opportunity for all of us in our various portfolios to look at systems and structures that have not worked for years and years and years, and look at more permanent solutions. Obviously, that's hard in a crisis, but certainly with the leadership of Kashechewan and other First Nations, including Grand Chief Fiddler as well, I think these are the kinds of conversations that have to happen right now, and they are. And I think the silver lining to a crisis like this is, challenging our assumptions about what is and isn't possible, and looking for creative, longer-term solutions in the interim.
Minister, stay safe, and thank you again.
Thank you very much, James. Bye.
Hit that subscribe button, hit that like button, share this video, and keep up to date on what's going on.